Hey guys! I hope you guys are doing well and not going insane during this time that we're all going through. But I wanted to kind of help myself, but also help you guys. I'm gonna do kind of like these videos of just going over really important stuff that is testable material for our OB test. I'm gonna break it up. So this first video is gonna be 2 parts, and it's gonna be the labs and diagnostic tests done prenatally. And then so in this specific video I'm doing tests for mom and baby, and then in the next one I'm going to do specifically more for the baby, and then hopefully I'll cover other things such as like postpartum nursing, complications associated with pregnancy, and anything else that like is what we could be tested on. So hopefully this is helpful. Again, I'm learning just as much as you guys, but to reinforce my learning, I'm gonna try to teach it back to you. So I'm gonna split up the video in this manner. So I'm gonna be covering this first. So I'm gonna be going in this order as well. So these are just labs. Well, actually what I discovered when studying these, most of the mom and baby tests, it'll make sense later, are more lab stuff. They're not diagnostic tests. So that's what I'll be covering first. So let's begin. So one of the first tests labs that is performed is the RH factor, and it's typically done in tandem with the blood typing. So the RH factor and the blood typing, they're done during the first trimester. And this is just to check to see whether the mom and the baby have matching or differing RH factors. So that RH factor is simply just this thing. So if I have a blood type AB, the RH factor is that plus or the negative. So it's really important to check this, and we do this by drawing blood from the mom and then blood from the umbilical cord to check the babies. It's important to check this because it is of a big concern and can be life-threatening if the mom is negative and then the baby is positive. So it's life-threatening. Just think of it like this. The mom doesn't have the RH factor, and so during childbirth, if the baby and the mom's blood mixes, the mom's body is like, whoa, what is that? And then it attacks the baby because it's like that's a foreign thing. So it's life-threatening if the mom is negative and the baby is positive. So what's a nursing intervention that is performed is we give the mom what's called RhoGAM, and this is just an RH immunoglobulin, and this is to prevent harm to the baby. So if, for example, though the mother is tested for positive, it's okay. That's fine, and then she won't attack the baby. If the mom and baby are tested the same sign, if they're both negative and they're both positive, then that's fine as well. So the only concern is if the mom is negative and the baby is positive, we give RhoGAM. So the next thing is blood typing, and this is usually done during the same time when we check for the RH factor. And so for the blood typing, we're checking to see for ABO incompatibility. And what that means is the different blood types, type A, type B, type AB, type O. So we're checking to see if the mom and the baby have the same type of blood. We want to know if they are the same because, again, if the blood mixes, it's very bad. It can turn bad. Such as like if you give a patient the wrong blood type, that's really bad. It's basically the same thing. So it's important for a pregnant woman to know not only the RH factor but the blood type, just in case of an event that she needs a blood transfusion. So it's in her chart, and then same for the baby, that it's in the baby's chart as well what the blood type is, and then we could administer the correct blood. So unlike the RH factor, ABO incompatibility can't be prevented. So we can't give them something, such as for the RH factor, we give them RhoGAM. That's not the case for ABO incompatibility. all we can really do is just check for signs. So signs can be assessed in utero, such as checking for anemia, or after birth, and like checking for jaundice. And if these cases do occur, then the baby could receive a blood transfusion, or they can receive phototherapy for the jaundice. Okay, so our third test, or we're going down this line, if you want to like write down what these are and then take notes on like the important things. Pause. So now we're on rubella titer. So this is checking to see immunity against rubella. So we give the mom this rubella titer, and rubella is German measles. And it's a blood test. Rubella titer is a blood test that provides a look at the number of rubella respondent antibodies in the mother's baby. And so the test seeks two antibodies, the IgG and the IgM. And we kind of talked about this a little bit in Pharm. But just know that the most important things about those two things, the IgM, it indicates the presence of a recent infection. And then the IgG, it's a protective antibody against rubella, i.e. the vaccination. And so there is a desired rubella titer ratio for immunity, and that is 1:8. So if it's less than that, then the mom may be at risk for rubella. So I know that was like a lot of information, so let me continue to break it down. So what's the reason why this is performed? So rubella tests help determine whether or not the mom is safe from an infection based on the number of antibodies in her system. And so think about it like this. If there's not enough antibodies, then the mother is at a higher risk during her pregnancy to contract an infection, and that also puts a higher risk for the baby to have any health problems as well. So it's done to, it's like a screening. We want to check how much the mom's antibody is. If it's less than 1:8, if it's less than that ratio, then the mom may be at risk for rubella. So yes. So nursing care that we should know. There is currently no treatment that exists for the baby that contracts rubella in utero, but this is why this makes for preventive measures really important. And that's why rubella titer labs are ordered super early in pregnancy. We should never give rubella vaccines during the pregnancy because the vaccine is a live attenuated virus, so it could cause harm to the baby. So this is performed in the very early stages. So, and then lastly, just to end this whole talk on the rubella titer, it's important to educate the women on signs and symptoms of rubella. One thing to report is if there are any presence of irregular rashes. So you want to have them know to contact their doctor immediately. So in the event of a rash, they would repeat a rubella titer 2 to 3 weeks after. And then, always provide education. Next, we have the H&H. Next, we have the H&H. So H&H, usually it's put together, but what it stands for is hematocrit and hemoglobin. So hematocrit is the total presence of blood cells, and then hemoglobin is the O2 carrying pigment on the blood cells. So the reason why this is performed is depending on the levels. If the mom has a low H&H, then that's indicative of anemia. The mom is anemic. And if the mom is anemic, that can cause problems for both the mom and the baby. So, for example, for the mom, if they have uncontrolled anemia, especially during labor and delivery, they're at risk for postpartum hemorrhage. That's actually the primary concern, postpartum hemorrhage. And then for the baby, if the mother does have a low H&H and if they do have anemia, it causes problems for the baby in terms of they're potentially going to have a low birth weight, and they're also at risk for premature birth. So we'll have a preemie. So important nursing care that we should know. During the third stage of labor, During the third stage of labor, the nurse needs to be very active in checking the mom and managing the mother's bleeding. That's actually the big one, bleeding. So we want to make sure that we're carefully checking the fundus. We don't want to, feel a soft and boggy fundus. We want a firm fundus. And then we also want to check for bleeding. So again, we want to see the amount, the color, if there's an odor as well, but significantly more the amount. So in that case, immediate interventions that nurses can do are 3. We want to make sure that the mom empties their bladder. 2, we want to massage that fundus. We want to have the uterus contract, and by contracting, it's going to kind of like squeeze those blood vessels to slow down that bleeding. And then 3, we want to notify the doctor immediately. Another important thing I think is worth mentioning is not only mothers with anemia does it cause them to be at risk for postpartum hemorrhage, but it also puts them at risk for mortality during birth. So again, these are prenatal labs. Right now, I've only really much covered labs. I haven't really done diagnostic tests. So these are diagnostic labs and tests done early in pregnancy because we want to prevent any complications, such as a big one is mortality during birth. We don't want that, or we don't want to lose the baby either. Okay, going down the list, we have 4 more after this one. We're on sickle cell disease. So sickle cell disease is when it's basically abnormal shape, when the red blood cells have an abnormal shape. So instead of it being kind of like circular and biconcave, it looks like a half moon. It looks like this. It looks sick. Maybe that's why it's called sickle cell. It just doesn't look normal, you know? And so in sickle cell disease, because the red blood cells are abnormally shaped, it causes circulation to be, it's difficult for that red blood cells to circulate. Therefore, it even can cause blockage, and because of the way that it's shaped, it can get clumped up, and then imagine those clumped up blood vessels trying to pass through a small vessel. Not good. So it could cause like thrombosis. So, and because of thrombosis, that causes pain and ischemia. So sickle cell screening is performed early, and it can be performed via 2 ways. We can either check this by doing a chorionic villus sampling. So that's taking a sample of the tissue from the fetal placenta, or we could take a sample of the amniotic fluid via amniocentesis. And that is something I'm going to cover in the next video with the baby portion. But yes, the reason why this is performed is if the mother has sickle cell disease, we want to educate them and let them know, hey, you have this, so you may experience, you're going to have more episodes of pain or infection than a woman that doesn't have a sickle cell disease. And because of that, symptoms can increase as the pregnancy goes on, and it also increases the risk for miscarriage, premature birth, and low birth weight in the newborn. So knowing the status of sickle cell in both the mom and the baby will help the nursing team forward and the people who are going to take care of that mom. And so important nursing care that we should know is we want to, there's a mnemonic. It says hospital, hop, H-O-P, it out. So H is for hydration, O is for oxygen, and P is pain relief. So nursing care is one, we want to make sure that we're encouraging these patients to make sure that they're hydrated and drinking a lot of fluids. Again, blood is more, I don't know the exact number, but blood is more than 50% made out of water. So we don't want to have the mom to have sticky blood. We want it to be, fluid, so it can kind of travel through the body more smoothly. So increase hydration, oxygen just to help if, for example, there's like tissue perfusion complications, and then B, pain relief. Again, like one of the things that we do in the postpartum assessment is checking for, Lourdes said that we don't do this anymore, but in the other books it says that we do. But the Homan sign, and that is just checking if they have a blood clot in their calf. So if the woman does have a blood clot in their calf, I don't know if you've seen pictures, but it's like their whole leg gets swollen, and then it's painful and hot and red. So that's what it's talking about for pain relief. So nursing care that we should know is we want to make sure we have the proper medication to be administered. We want to stress the importance of hydration. We want to also educate them on the possibilities for birth defects in their child and result of the mom having the sickle cell disease. And yes, that's it. Moving on, we are now on hepatitis B. Hepatitis B. All pregnant women should be tested for hepatitis B in their first prenatal visit. Very important. The test checks for hepatitis B surface antigen, and it's performed regardless the mom has had a vaccine for it prior to pregnancy or not. So it's a standard thing. And this test is performed by drawing blood. So the reason why this is performed is because moms who are tested positive, there's an increased chance for their baby to also be infected with the hepatitis B as well during childbirth. And this is bad because if the baby gets it, then they can develop chronic hepatitis B. So, however, So yes. So moms are tested to see if they have hepatitis B because it is preventable from the baby developing chronic Kiana texted me chronic hepatitis B. So prior to birth, moms again should be tested for hepatitis B via blood draw and should be educated on their child's risk should they be positive. So directly after birth, the baby should be administered a dose of the hepatitis B vaccine as well as a dose of the hepatitis B immune globulin. And this must be done the first 12 hours of life. And then after that, you also want to educate the mom and the parents of the remaining other vaccines that the baby needs to get. Okay, we are almost done. Now we have the urinalysis or urine culture. So this is pretty simple. This just gives an overall adequate overview of the mom's health. So with the urinalysis, we can check to see multiple things. We could check for the mom's hydration level. We can check for the nutritional status and ketones. Sorry, it's Kiana. And the status of any infections by checking for the leukocytes. Checks for also protein levels and blood cells to assess if there is any recent UTI, and then also can check for glucose for diabetes. So I think those are the two big ones. It checks for one, hydration problems. So we want to if that's the case, we want to educate them on fluids. And then two, it checks for glucose problems. And if that's the case, we want to educate them on gestational diabetes. And then lastly, these kind of go hand in hand together. Typically, the Fern Test and the Nitrazine Test are done in tandem. And the Fern Test is performed to identify. It identifies one if the woman is ovulating, and it shows this by, if you look it up, it's pretty cool. Search at Fern Test, and you could tell that a mom is fertile or ovulating if the pattern on the microscope side, they take a sample of the cervical mucus if it has the shape of a fern. So the Fern Test measures the presence of amniotic fluid, and if the amniotic fluid is present, it can indicate a ruptured membrane, which can cause infection in the baby and lead to death. Oh, something got in my eye. And then if amniotic fluid is found, the solution to it is the onset of labor. Oh, something went in my eye. So nursing care that we should know is we want to make sure that we educate the mother on the test and its outcomes. We want to always use sterile swabs to collect the secretion and then have the mom in a lithotomy position. So when we do assess the amniotic fluid, we are checking for the pH and then also for the presence of that Fern pattern. So now, what is that test called to determine the pH? That's the Nitrazine test. And it determines the pH of the mother's vaginal and amniotic fluid. And similar to the Fern test, this is performed to figure out if the membrane was ruptured. So be aware, if the pH level is anything from 5 to 6, so if it's acidic, that means that the membrane is most likely intact, and that's good. But if the pH level is 7 to 7.5, which is alkaline, that points towards a ruptured membrane, and that is something to be, to call the doctor for. So yeah, this is all for the mom and baby tests. I was really speaking fast, trying to make sure it's short. So I'm going to do another video on these are for the lab/diagnostic tests, specifically more aimed for the baby and the baby's health. Yeah.